Hi, I'm Jed, and I'm delighted to be joined by two guests today. Well, friends, really. I want to talk about two difficult subjects, suicide and autism. And we'll talk about those positively, obviously, as well. But they can be difficult subjects for us. So take care in watching this and listening to us. So I'm Jed, and this is Tom, who's I always say is my opposite number. So I'm the chief exec of PAPYRUS, and Tom is the chief exec of Autism Action, with whom PAPYRUS has a lovely partnership working together. And this is my colleague Rachel, who's a research psychologist, who will share her own story as we go through. I thought we might start this conversation, and that's what it is, a conversation between friends all, around language, because driving here, and often I think that one of the many overlaps between these areas, i.e. suicide or suicide prevention and autism, is the whole concept of how difficult it is to have the right language. So, for example, as an organisation, we often talk about how insensitive language can really hinder help seeking. So, for example, if we use the phrase committing suicide, it suggests that suicide is still a crime. So we tend to sort of educate people, if we dare, to say actually sometimes some people find that difficult. And it got me thinking about the language around autism, and autism has its own vocabulary and lexicon, I'm sure, and I'm sure that I'll get things right and wrong, if that's the right labelling during this conversation. Tell me a bit, Tom, if I said to you the language around autism, what happens to you? What comes up first for you?
Well, I think we need to make sure language doesn't get in the way of helping people, of talking about important subjects like this, suicide sensitive. It is important that people try and get the language right, and there's some great guidance out there for people that want to understand, or why this term and not that term. But ultimately, we need to make sure language isn't a barrier to people getting much needed support, and just to talking about it, you know, to having everyday conversations, to professionals feeling comfortable and confident thinking about autism and autistic people's needs.
Yeah, I often think a difficult conversation with the wrong words is better than no conversation. Would you agree, Rachel? Where are you when I say language and autism, for example?
I think generally I would try to follow a principle of talking about autism as a neutral, inherent part of someone's identity. So we've moved away as a field generally from talking, from using what we call person-first language, the person with autism, because it kind of implies that, you know, this is something negative that I've got with me, almost, you know, like I might have a disease or the like. Whereas often when we talk to autistic people, they say, you know, this is part of me, and I can really identify with that. I don't know, Rachel wouldn't exist. There is no non-autistic Rachel. And so I think that what we call identity first language makes it just a neutral, even helps us allow it to be a positive part of someone's identity.
Yeah. So do you want to tell us a little bit about Autism Action, Tom, for those who've not come across your organisation, and maybe I'll do the same about PAPYRUS as well.
So we're a relatively young charity still. We exist to fund and commission research around autism, around the things that really matter to autistic people, things that are going to unlock knowledge and understanding that's going to make a difference to autistic people's lives. But research by itself doesn't do anything. You know, it's great to learn things, to have those insights, but you've got to turn it into action, hence the action in the name. And that can be about changing things at a governmental level, around legislation, around policy. It can be changing at a societal level, about understanding and about tackling stigma. But crucially, I think this is really what's underpinned our kind of emerging partnership, is how can you work together with people who are out there in the field, trying to make a difference, trying to impact people's lives, trying to do the good and right things that we know, particularly autistic people, are lacking, you know, in particular areas. How can we help people that are already doing good work do it better? So We are keen, obviously, to work with you guys, but to work with anyone who is looking to fill those gaps and perhaps doesn't feel that they're particularly have a good evidence base or a good research base for that. And that's where we can come in and help make that better.
Yeah. I know you're going to be biased, Rachel, about research, but what place do you think research has in this whole conversation, this dialogue?
Bias. Well, yes, I am passionate about research. I think where the dynamic needs to be more nuanced, though, is that kind of traditionally research has tended to be about a population. It hasn't involved that population in sort of, what do they think is important? What do they actually want? And so, as important as research is, it does strongly need to be driven and led by the needs of the community, which is something that is at the heart of the research Autism Action promote and initiate.
I'm delighted to hear that, because I've got an experience in my head. Let me share it, so at least it's out there. I was part of an organisation for a while as a volunteer, and then I moved away from it, and I went back to a meeting at this organisation, and the most often used word was we, and the more it was used, the more I felt like they. And when I was driving here today, I was thinking how the question would be, how do we include the community we're trying to serve in the research in this case? Who is the we and who is the they? I'm delighted to hear what you've done, that you've gone to the community and said, tell us what it's like. Not. I love that thing. We need to move away from what's the matter with you to what matters to you. Even the conversation about problem suggests that there's a problem. Actually, there's so much giftedness in every community. We need to embrace that and hear that story, which is something I think that's not peculiar to Papyrus, but in our DNA is hearing story. So there is no such thing as a suicidal person. I'm not a person with thoughts of suicide, but I have been, So at the moment, I'm a person whose story needs to be heard. And every day on our helpline, we're listening to people. Every night, we're listening to people's story. And often it's they who do the work, not us. Out in the community, training people. How dare we say we're going to give you skills to intervene? Actually, a success story for me is at the end of a training session, people saying, oh, we've been doing this for years, but now we know we're doing it okay. Letting people come forward with their lived experience and living experience is something that I think, are beginning to see is part of our common DNA. That's what drives both organisations. We're not speaking about you or to you. We, and I mean that we include everybody, whether you're autistic, whether you're currently thinking about suicide or not. We have a common thread in that we're human beings.
And I think the history of probably both autism research and autism charities hasn't always really recognised the need to think about the we, to make sure autistic people are at the heart of work, that lived experience is really driving everything, and that's what we're trying to do at Autism Action. But I think it's about, it's a practical question as much as it's about a sort of values question, I suppose, because it's all well and good to say, well, we'll be collaborative, or we'll be, we'll really involve people in our work, but that actually takes you to do the work you do differently. It takes you to really think about, what does that mean? Sometimes it means you've got to do things a bit more slowly. It means you've got to create time, you've got to create accessible ways that people can actually do that. You've got to not make decisions and then go back to a community of people and say, and get a rubber stamp for it. It's about really working it through everything you do. And that it does take work. It does take you to be deliberate, but I think it's the right thing to do, and it makes for better outcomes for people. Because something that is not based on people's real experiences and genuine day-to-day lives just is not going to make the difference that we need it to. And I think that works for researchers as well, Rachel.
Absolutely. And I think this is one of the reasons why we know that some of the kind of standard offerings in terms of psychological interventions don't seem to be as effective, as helpful for autistic people. And that's because they're designed without any autistic input. So they might not necessarily address the things that autistic people are really struggling with and what they really want to get out of this intervention.
Interestingly, one of the things that we got feedback on as a charity was that we were very good about telling people about the size of the problem, but not so much about how much we help people. So we're very good at talking about death and suicide, and I'll never make an apology for doing that, because if we're silent about suicide, if PAPYRUS is silent about suicide, then the society will follow, perhaps. We're already silent on it. And we need to change that narrative. We need to be more sensitive about speaking openly about suicide. So again, I'm drawing a parallel here with autism. And it's an area, if we're ignorant of it, or it's not been part of our life experience, we perhaps pretend it'll go away if we're silent about it. So for those who don't know, there's suicide data in this country for the whole of the UK. There are about 650 murders every year, and there are about 10 times as many suicide. Now that's a shocking statistic. 6,500 is a conservative estimate. And the numbers over the last 100 and odd years have come down. So we know that suicide is preventable by reducing the access to the means, by increasing support, by education, and so on. And in young people, the numbers are around 1,700 deaths under 35, usually about 600 to 800 in this sort of 16 to 24 group, and 200 children every year die by suicide. So that's the data for those who are interested in such things. And it's important that we know the scale of the problem. Rachel, I'm particularly keen about your research, because over the years I've been privileged to walk alongside dozens and dozens, hundreds perhaps by now, of parents and young people themselves who shared their story with me about either having thoughts of suicide or somebody having been lost to suicide. And every one of those is a tragedy, and every one of those is a story that needs to be heard. Tell me a little bit about the data around suicide and autism. Over to you, really.
Sure. So maybe I'll start with what we know about the scale of this issue, as you say. So the statistics we have come from a number of very robust, large-scale studies, not mine, I should say. Mine is sort of filling in the gaps around the sort of contributing factors. But what these large-scale studies tell us is shocking and quite frightening. So what we know from these studies is that autistic people without learning disabilities are 5 times more likely to die by suicide than are non-autistic people. And I can make that perhaps more concrete still, because studies have also told us that perhaps 1 in 3 autistic people will experience suicidal thoughts in their lifetime, compared with 1 in 10 non-autistic people. And then another statistic is that 1 in 4 autistic people will actually make a suicide attempt during their lifetime, compared with 1 in 37 non-autistic people. So we have these awful statistics, but we also know that within this community there seem to be individuals who are at higher risk, because the autistic community is very diverse. But what we seem to see is that autistic people without learning disabilities seem to be at higher risk. People with co-occurring ADHD, gender minorities and women, and people who are late diagnosed or even undiagnosed, they all seem to be at particularly high risk.
Gosh, I'm just, as the listener, as the viewer will be, I'm a bit aghast at some of those numbers and trying to compute them really. And if you're the autistic person, that's one thing, and going back to the parent, carer, loved one, to know that will be shocking. So I'm just acknowledging that for those who are watching this, it may be a difficult watch, a difficult message. Tom?
I think it's really important to remember that it's that what Rachel's just talked about, it's not inevitable. It's not an inherent part of being autistic.
Yes.
People tuning into this conversation, they might think, gosh, does this mean
am
that
I next?
Am I next?
Yes.
Exactly. And it doesn't have to be that way.
No,
We do have to, and what I think Rachel's research is starting to point to is how we can intervene, how services need to change, how society needs to change in a way that sends those statistics in the other direction. So it's bringing that down. Part of the challenge that we face, there's two really around the numbers, is first of all, there isn't great research so far. Incredible work is happening to try and fill those gaps in, but there isn't that understanding of why. You get a sense of these headline numbers, but why? What's contributing to that? And the other thing is, government doesn't collect data in a particularly coherent way around this. There are little pockets where it's quite good. It seems to match, when official statistics seem to match what academic research has found. But to get government to really take it seriously, they tend to like their own official statistics, don't they? And if they're not asking the right questions in that, when someone sadly dies, if they aren't actually saying, well, was this person autistic? Is it in their health records, etc.? Then it's not going to feed into then real action to help prevent that. So we do still have to do more just about the numbers, make sure that's better, make sure the research is there that points the way forward. But then that's not an excuse not to do anything in the meantime as well. We've got to get on with tackling this as whilst the numbers catch up.
Again, a strong sense of why you're called Autism Action. Let's not just talk about it, let's do something about it. I mean, coroners in England and Wales are fairly powerless without, even the chief coroner can't change the law, or he can give guidance. But even, and you're going to kill me for saying this, even without the research, we kind of know, don't we, from lived experience, we kind of know that some of the contributory factors to, even without looking at the autistic community, I would say this is true, that in general over the last 30 years, we've improved the way in which people are able to say, I'm feeling sad, I'm feeling poorly, I'm feeling my mental health is compromised. And we've done a good job collectively over the years in educating people to say, me too. What's not caught up with that is service provision. Is that particularly the case with autism?
Sadly, I would say service provision in terms of for autistic people is very, very poor, very far off where it needs to be. There really isn't much in way of services that are tailored for autistic people. It gets worse as people get older generally.
Really?
And it's really problematic in many ways, but in part because autistic people don't necessarily benefit from the sort of cookie cutter standard approach. In fact, in many cases, it can make things worse. And so by trying to force autistic people into a mould, services can actually do more harm.
I think what one of the things that I found really impactful from Rachel's research, and that I think it sounds bad, but I think it also points to a way forward where that doesn't have to rely on whole swathes of specialist services being developed, but something that could happen quite quickly, is the experience that autistic people have of when they're feeling suicidal, when they reach out for help, particularly within the NHS, they're not believed because perhaps they don't present in the way that that non-autistic people would. So perhaps there's a different sort of emotional presentation, or a different sort of communication that comes around saying, well, actually, I'm thinking about suicide, or I'm even have plans.
Yeah.
Because of that, they're not being believed, they're being dismissed, having their experiences minimised, which then actually has that detrimental effect.
Yes.
It means making it worse. So it's not only are they cut off from support that is there or could be there, it's actually increasing their feelings of hopelessness and things like that.
Yeah.
Now, that to me, I mean, that's awful. That's absolutely terrible. That should not be happening. But it does point to a way that it's quite an easy fix. If you can shift to a position, particularly across the NHS, where people are believed, where people are not dismissed, where people are not having that very real distress minimised just because they aren't presenting in the way people are expecting, you can start to, it's about shifting the narrative, isn't it? It's about shifting that narrative within health and service provision without having to create a whole set of special services.
I think you're
got to be clever with how.
I think you're onto something. Without being fatalistic or hopeless, when I say, there is a sense in which the more charities like ours ask more of public sector or each other, the more burdensome something can be. So an example would be, if we're asking teachers to talk about suicide in school, the first response might be, I've already got enough on. And I capture it in this phrase, I'm not asking you to do more, I'm asking you to be different. Sometimes it's attitude. If the first thing is, oh no, this is too difficult. It's like going back to our first conversation today. If I think the language is going to be wrong, I better be quiet. Well, just say it. If you're going to do something, do something. Don't let the language get in the way. And I think sometimes teachers think, oh, I can't talk about suicide, it's too difficult, so I'll not say anything. Or people who are providing, for want of a better term, mainstream service in the NHS might think, I don't know how to make it special or different, so I'll just carry on. All they need to do is ask the person what they need.
Rachel, in the research you've done, what do you think are those sort of outside of services, or those sorts of social factors that have come out in it that sort of speak to some of what Jed's saying?
Yeah, the social factors. So, yes, well, the things that the research really highlighted in this most recent study that's been published were very much societal factors. They were being victimised, experiencing trauma, experiencing abuse, being unable to access help that you needed. And autistic people really gave such rich, in-depth descriptions of what it is like to live as an autistic person in this society. One person used the amazing phrase that they felt this was an uneducated and unempathic society, where services simply did not have the knowledge or the resources to help. Sometimes didn't listen, sometimes dismissed them, as you said. And as such, a lot of trauma was actually being perpetrated by the services that autistic people were going to for help. And as Tom said, that's an incredibly damaging experience, because in our participants, this really engendered feelings of hopelessness. And feeling even more alien, like no one has ever had this problem before, and no one can help me, and I shouldn't be here.
Any other sort of examples? Because I've learned so much from these podcasts about the lived experience, the vicarious lived experience. We talked a little bit about the stories of the person, the patient. But I suppose what's coming out of this is sometimes the patient is king, and rightly so. The patient's needs need to be met, but sometimes the parent or the loved one is left out of the picture. Did that come out in your research at all, Rachel, or was it more?
I would say that the research really, actually, it was a kind of unanimous point from both autistic people and their families who took part, that they weren't being listened to.
Okay.
So families were also feeling that they weren't being listened to,
Yes.
that their autistic loved one wasn't being listened to and taken seriously. And families, in the research, we had quite a number of parents. We had quite a number of people who'd been bereaved by the suicide of an autistic person. And some of the stories they put forward were just unspeakable, really, of so many instances where if something in that perfect storm of, the phone call that didn't get made, the referral that didn't go through, all these places where something might have been different. So all these stories together just paint such a strong picture that something needs to change.
Speaking of coroners, and death and dying can make us all feel a bit gloomy, but that's the world that we inhabit, sadly. And coroners do a great job to find out the truth of who died and what happened, and hopefully how we can prevent future deaths. But let's change tack a little bit, in the sense that we're all here to promote life, and with all its ups and downs, aren't we? And trying to find hope even in the darkest day or the darkest night. And one of the things that strikes me is that as an organisation, PAPYRUS wants to learn. And we spoke earlier about the NHS are not bad people. They want to do better. They're sometimes under tremendous pressure. They've got colleagues and friends and family working there, and they come home and they're absolutely exhausted, trying to do good and the best they've got with limited resource. What might we collectively do to build back better? What might a service like Hopeline 247 do to make sure that it's providing optimal support for autistic people, Rachel? What stories are you coming up when I say that? What does good look like for an autistic person who's reaching out for help?
I'd say first off, your first step always really needs to be to go to the autistic community and ask them, what should we be doing? What do you want? What would best practice look like? So really, I'd say involving the autistic community in a meaningful, fundamental way, not a tokenistic way, and being prepared to listen, including to things that might feel uncomfortable. So in the research we've been doing, autistic people sometimes said things that I think a lot of people would find quite uncomfortable to hear. For instance, people talked about how actually for them suicide was very rational in the context of the lives that they led. This is something that you can't really talk about easily, and you can't publish it. It's very controversial. But if we don't listen to messages like that,
very
how
powerful.
are we going to actually change the things that need to be changed? So I'd say listening.
If I may, you remind me of a piece of research we did. So parents who'd lost children to suicide, around 1997 when we were founded, around the time of the start of the internet for most of us in the early mid-90s. And lots of websites were out there teaching people how to kill themselves. So obviously we had sadly a huge number of parents who were saying, my child has died because of what's on the net. We did a piece of research, and the surprise that we didn't want to hear was lots of the young people were saying, don't take the bad stuff down, because I need to juxtapose it with the life stuff. So it's an example of research can really help us to hear some tough messages.
Yeah, absolutely. And I think the other point I would make kind of goes hand in hand with listening. Research talks a lot about how good interventions for autistic people involve what we call cultural humility on the part of a non-autistic person. And basically what that means is adopting a perspective where you recognise that there are different kinds of mind in the world, and your mind is not inherently superior or right. It's just that, there are different kinds of minds, and you realise that you might be speaking slightly different languages, but you're here with the same intention and goodwill. But it's respecting that, the person isn't broken, they're different.
No, that's right.
And I suppose linking back with the listening, you're giving their point of view absolutely equal value to your own.
going back to my we and they thing, isn't it? Like I suddenly felt like a they or a them rather than a we and an us. Yeah, it's very powerful. Tom, any insights on that?
Well, I think that, just building on what Rachel was saying, the opportunity for all services, whether it's part of the NHS, whether it's what charities provide, whether it's just within communities, to really think about that, different, not less, to really take away any sense of stigma that comes that society may still have around autism, but autism and suicide in particular, and applying it very specifically here, and being far more open to thinking about a different way being possible. And I know that because sometimes sound a bit abstract, or a different way is possible, but I think it has real meaning, because when someone walks into a room and perhaps they're not communicating as you might expect, they're not presenting as you might expect, don't meet it with hostility, don't meet it with defensiveness, meet it with openness, meet it with a sense of curiosity and how we can learn together, and how this is an experience which is, I always think about, we think about being autistic and being non-autistic as different neurotypes, different ways the brain works. I always think about bridging the kind of neurotype divide. I think that's it's probably a fancy way of saying just got to make more effort to understand different perspectives and different bits of lived experience. And Rachel talked about the impact that trauma has within that, life experiences. If you're not listening and not open to those, then how on earth can there be support that's right? But
I think the increase in the language around trauma-informed approach generally is a challenge for most of us, because we all, I tend to think I'm pretty trauma-informed. I did a course on that or whatever. One of the things that I notice in myself is the longer I'm in suicide prevention, the less I know. What do I mean? Because as soon as I think I know, the next person who dies is different, or a parent will say, but my child wasn't, or as though we've got a typology around. And there's a parallel here, because I think I know about autism because I've got an autistic friend. I know about that person a little bit, and I don't know what their world is like. I don't know what autism looks like. So let me draw a little sort of analysis first. Firstly, in simple terms, suicide is hard to spot in a person because we generally hide that because of stigma and 1,000 years of history of criminalising people who are suicidal and putting poorly people in asylums and all of that. So of course we've learned to hide that. And actually over the last 20, 30 years, hopefully we've done something to contribute to changing that narrative so that people are more likely to say, well, actually I'm struggling. Engaging with an autistic person for somebody who's never thought about that. Is there any tips, tricks?
Well, I mean, one of the things that people can do is educate themselves about autism in general. They can talk to autistic people, they can read some good stuff about it. I mean, it's what I was talking about, that curiosity and openness. Yeah. But I think one of the kind of critical bits of perhaps where we go a bit wrong is the lack of understanding of how much work autistic people do to try and fit in with normal society, and the impact that can have, and then the difficulties I think that can have further down the line. So something around sort of masking as a concept, I think is...
Yeah, tell me about masking.
Masking, yes. Masking, oh, it's a topic we could talk about for hours. It's essentially effortful, well, actually no, I've already. So sometimes masking is conscious and effortful, sometimes it's automatic, so there's many different ways that people mask. Essentially what it means is hiding your differences, hiding your difficulties. Yes. So some of the ways people mask might be quite conscious and intentional, so perhaps copying body language, learning how to make eye contact, speaking in a certain way. But you will also have quite automatic behaviours that people don't necessarily know they're doing. So people pleasing, for instance, always deferring to others, always trying to make yourself as small, as pleasing as possible. And what we know about masking is that it's exhausting, and it ties into a lot of negative consequences. So, for instance, often people aren't diagnosed because they're such good maskers and they don't necessarily know they're doing it. It's also linked with people sort of underestimating your support needs. And people in our survey said that often they weren't believed when they went to try and get help because they masked so well. So it's a real double-edged sword, because it is a suit of armour that autistic people wear in the world. They mask in order to not be victimised.
I'm fascinated by the parallel between masking and hiding our suicidal ideation. I think that's where I was going in my rather clumsy segue from the previous section of this conversation. So I don't want to equate the two. But my message is, if you're thinking about suicide, you may want to hide it because of reasons, history, acceptance or lack of. And I guess that's a little bit of the experience of a person who feels because of their autism they are somehow needing to conform to the common experience of others.
It's a really tricky one. I think one of the things, one of the complex messages is that in a sense it needs to be a two-way street, because it isn't always a safe world for autistic people to unmask in currently.
Right.
So we know that there's a lot of inequality, there's discrimination, and so we can't really put all the onus on autistic people to unmask unless it's a two-way street and we make it a safe world for them.
I get that.
We know it's a brave step that people take to ask for help, to reach out, and I think in that moment, how you navigate that moment in a way that creates trust, that builds a connection, that builds understanding, can be critical to what comes next. I think what Rachel was saying as well about really applies in that moment of talking about suicidality, because quite often perhaps autistic people are not going to present as typically, and that different reaction shouldn't become a barrier to then taking that forward, to having the conversation, to proceeding, to being believed, as we were saying before. So what the masks that come off, the masks that can be held, and the masks that have to stay on, there's got to be a bit of everything, and it's going to be different for each person.
Well, on that different thing, I'm going to feel this, so I'm going to take the risk. Give me some general idea of what some of the. So you mentioned eye contact earlier, Rachel, and I'm assuming that's something that some autistic people don't engage with as readily as perhaps I might. Another person who's not autistic might struggle with eye contact as well, but I'm tentative here because I don't want to get it wrong, but I'm going to do it anyway. Tell me some of the general truisms about autistic people. Like, is it eye contact? Is it sensory overload, or things that I'm hearing? Tell me a little bit about. I know it's not a list, is it? It's like every time I go on the telly, they say, give me a list of the things you look out for. And I say, as soon as I give you a list of 10 things, it'll be the 11th. You should have, so forgive me for asking for a list. But
I think the experience of being autistic is many, many things. And it's a bit different for everyone. It's fundamentally a different way of experiencing and interacting with the world. So differences in your language, in your social interaction, in your sensory experiences, in your attention and the way you think, all these things. But it will look a bit different across everyone.
But that's really helpful. That's really, if I'm benefited, I hope I'm not the only one. That general sort of overview, the sort of summary, but it's the complexity of that.
I'd say in terms of that complexity, that a lot of the experience of being autistic, at least for quite a lot of people, is quite an internal one.
Okay,
Because we learn that we are different and that the way we are is not appropriate. And as such, a lot of, going back to masking, we do a lot to try and change ourselves. And as such, our autism might not be visible to you, the observer, because we're working so hard. So in that sense, my experience, depending on how good a masker I am, my experience might be quite hidden from you.
Yes.
Because I might be doing such a good job at kind of flying under the radar. But it's very much not hidden for me, so it would be certainly very weighty for me.
I feel so privileged sitting here listening to that. So yeah, I don't know if it's appropriate to say it, but I'm going to say it. Thank you. Just the privilege of just sitting here and talking about this. I'm going to pick up a word before we go back to warning signs. Appropriate. It's a rhetorical one, really. Who says what's appropriate? You know, and that we, they thing, you know, like my appropriate's not your appropriate and vice versa. And that we just need to really embrace a wider sense of okayness together. Then going back to this warning signs thing, we did a video that you can watch online called Spot the Signs, and the idea was that people wore a big message saying, I'm going to kill myself, and the premise was nobody sees the signs like that. We have to look out for them. Again, at the risk of homogenizing all autistic people, what, Tom, do you think would perhaps be a way to recognize that somebody might be suicidal as an autistic person feeling thoughts of suicide? Would there be a difference? Would I need to hone in a different sort of antenna? What?
So there are some differences and there are some similarities to what non-autistic people experience. So, for example, what you might see is withdrawal from things that people find pleasurable, interests. For example, lots of autistic people will have very strong interests and passions in a particular area. It might mean a withdrawal from normal routines. Some autistic people have a strong preference for routines, and you might see changes to that. An increase in self-harm, and that's not necessarily an autism-specific thing. Changes to perhaps how people communicate as well. I mean, my own son's autistic, and we have to kind of monitor his mood quite a lot, but he can be quite adhere quite a lot to his routine and things. So it can be difficult to spot those signs.
And I think it's again, I tentatively use the word spectrum. I think suicidality is on the spectrum, crudely from okay to dead. Sadly, I often think that my experience of that well-being is not a linear thing. It's more like a scattergun. It's more like an aerosol spray. It's not just a one line. It's a series of dots everywhere, and we're all sort of in the middle of that somewhere. For an autistic person, is there anything you would add
I think
to that picture?
One of the challenging things about recognising warning signs in autistic people is that some of the things that are normal for autistic people might actually look worrying if you were thinking about them in a non-autistic context.
Right, yes.
So, for instance, actually it's really important that autistic people can withdraw socially and they need their alone times. That's normal.
That's right.
And it might be that a certain level of anxiety is normal for a person, and a certain level of emotional dysregulation, difficulty sleeping. So a lot of things that you might look out for aren't necessarily clear warning signs. And in general, although we really lack research in this area, the key thing that really seems to stand out is change. So you need to know that person's normal, which can be difficult. So how do they normally speak? What do they normally love doing? What's their normal routine like? Their sleep, their eating, all these things. So if you don't know those things, these red flags are less reliable in autistic people, and non-autistic people are not so well equipped to spot them, which which might be one of the reasons
You
why.
mean for themselves?
To recognise them in autistic people.
I see, yes, yes.
So, so non-autistic, maybe doctors, for instance, won't necessarily recognise that someone's in crisis.
Yes.
Or alternatively, they might misinterpret something which, and sort of get the risk, gauge that risk incorrectly, which can actually also be quite harmful. So we hear stories of people who are sent to, autistic people who are sent to A&E, accident and emergency departments, which is a very unsafe place for them, really.
Yes.
So either way, you absolutely don't want to miss the signs, but you also don't want to misinterpret someone's behaviour.
Yeah. One of the things that I think a lens into suicide prevention is how any person responds to a change in their life, however small. I fundamentally believe that wherever there's a change, there's a loss, and we grieve that loss. And the level of grief will depend on the significance of the change and that which is lost. I'm guessing for many autistic people for whom regular routine is very important, that can be accentuated.
Yes, so struggling with change is really a key feature of being autistic. And I think you make a really important point there, because research is telling us that autistic people are traumatised by a broader range of factors than what non-autistic people typically think of when they think of trauma. And so, for instance, moving house might be experienced as quite traumatic for an autistic person, and they might show kind of post-trauma symptoms and possibly suicidal thoughts, actually related to something that you wouldn't necessarily, you wouldn't know that something traumatic had happened. And I think it's possibly also relevant in this context to talk about how this really came out in the research, how being autistic can sort of augment or worsen sort of the impact of traumatic and difficult life experiences. So, for instance, autistic people often are quite isolated. So it means that you don't have a social circle that you can kind of bounce things off and sort of calm down. We also tend to have very sort of sticky thought processes. We tend to get stuck in a loop, find it really hard to disengage with thoughts. So you've been out and something bad's happened to you, and right round and right round and right round, and you can't get off it.
That's very interesting.
It's also an element of that is finding it harder to find alternative solutions. So if there's a problem that I'm struggling with and I'm experiencing suicidal thoughts, if I'm an autistic person, I might find it a lot harder to think of other things I could do to get out of this issue. I don't necessarily have the same flexibility in my mind.
So am I being foolish in saying that, let's say you for shorthand, for you to say, oh, you can call us, you can do this or you could do that. I think you've got to almost want it, haven't you? All right, tell me a little bit about that.
If I may, I'll draw on lived experience here. I wouldn't say want it in my own individual context. Everyone very different. But I would say in my own individual context, other options don't exist.
Okay.
They don't exist. It's not that I could call my sister, or I could do this, or I could do this. I'd say the lived experience of suicidal thoughts for me has differed at times, but one quite common manifestation for me is it feels like a wall going up here. There's just an endless wall. And it's not that I think I could do this or I could do that. There is
it's just not
there is no way. There is only the wall. There is only that one way out.
I suppose my impulse, though, as a helper, is always to say, what can I do to help you permeate that wall, isn't it?
Well, I think you're absolutely right to say that, because I think when you're in that moment, it is impossible to see past the wall. The wall just goes on forever. And I think it's other people outside you who can actually say, oh, hey, I'm on this other side. I'm with you on this side of the wall, and maybe we could go this way, and maybe we could do this. And what we know about suicide from research is that people can move quite quickly and fluidly, as you know, out of suicidal states. And so often it's about helping someone and keeping them safe when they're in that most vital period, when the wall is right here. And over time, that wall might kind of recede, and you can see more. Okay,
it's fascinating you use the word wall. One of the things I often talk to people about is Papyrus will sit with you at the wall of death.
Really? Wow.
Not try to give you reasons to live, but indwelling with you at the wall of death, which is not easy for you and it's not easy for us, but it's harder for the person. We often say to people when we're training them, what's it like for you to sit with the person at the wall of death? When literally you've just described beautifully from your own experience what many people experience when suicide is their only option, which is one of those signs that on our video that we made, that a young person would say, suicide is my only option. It's impulsive in my part to say, oh, you could do this, or especially if it's your son or your sister, your daughter, your partner, to kind of fix it. Actually, what the person needs is somebody to say, I don't know what it's like, but I'll sit with you to help you when you're ready to move towards life. And even in finishing that sentence, you want to sort of say, and then we get to a safe place. Actually, you may not. What we try to do is to say to a person when they are thinking about suicide and all they can see is death, is to listen and listen and listen again until part of them expresses some uncertainty. And that uncertainty is the juxtaposition between living and dying. But if I was to say, oh, come on, Rachel, what about this and what about that? Those options are just not there for anybody at that point. They're my need, not yours. Yeah, so it's beautiful. Again, thank you for sharing that real, what's it like for a person. And I would say, if you're watching this, a question that perhaps we could take home is, when you're thinking about suicide, you may be at that wall, or when you're caring for somebody, the impulse to fix it for them is greater sometimes than what's effective. And what's effective is to sit with them in their space and let them be. And in that letting them be, they will find the solution with your support. Put you on the spot, Tom. What does change the narrative mean this year in terms of autism and suicide prevention?
So I think there's a few things really, and the first thing is that there are autistic people. They are among us, they are with us, they are friends, they are loved ones, they're family members, and there needs to be absolutely better recognition of their real life experiences and the fact that they are experiencing suicidality at a much higher rate than perhaps people have understood. So there's a bit of the if you like, the negative change the narrative there, but the positive thing is it's not inevitable. People can be helped. People want help, and that's really important to be understood. And I think the other bit of change the narrative means about autism and suicide is that people need to be believed and they need to be heard. And we've talked a lot about listening. We've talked a lot about people's real stories. I think it is for autistic people to change their own narrative. It's not for people to change the narrative for them. So making sure people are really feel respected and listened to tell their own stories and to own their own experiences. But if there's a wider change of the narrative, if I can broaden it slightly, I think that what we've seen recently, and I think it's really damaging for autistic people, is a narrative that autism is being overdiagnosed. We're sitting here, we're having a conversation today about there's more autistic people out there than perhaps people have recognised before, that we've seen this societal and historical shift in understanding that there are more autistic people out there, but there is pushback against it, and that pushback is coming from some pretty sort of unsavoury sources, really, and I think it's happening for with quite bad intentions, trying to almost put autistic people back in their box.
Right.
And it's pushing back against what we've been talking about of believing and listening to people. This idea that autism is somehow overdiagnosed because we're seeing different sorts of autistic people being more prominent in the media, talking for themselves, telling their own story, owning their own history, is hugely damaging. And I think personally, and I don't know if this comes out in the research, Rachel, but I think it does speak to that that sort of societal stigma that people are trying to say no, you're not being believed, and which can have that impact on suicidality. So it's really important that if we're going to change, if there's a narrative we're trying to change, it's that overdiagnosis narrative. It's damaging, it's inaccurate, it's deeply unhelpful, and that it's just impractical. If you don't diagnose somebody, they're still there.
What we're dealing with, that's right.
They still might need help and support. You're just removing the ability for that person to perhaps understand themselves, for the people around them to understand and support them better. And then when it comes to it, the point where they're reaching out for help, say, well, I'm autistic and this is what I need. But so if there's a narrative I want to change, it's that.
Strong message. It's
I
good.
would second that strongly. The idea that autism is increasing is a sort of related one. People say, what's happening? Is it vaccinations? Is it
Something
whatever?
in the water.
And the thing is, studies show us that autism is not increasing and it is not being overdiagnosed. What is finally happening is that we are recognising people who've always been there. A lot of people who have died by suicide undiagnosed. So studies suggest that perhaps 40% of people who died by suicide in England were possibly autistic. And it's sort of a strange conversation to be having in a sense, because the fact that we're diagnosing more people than ever is such a good thing. Terms of diagnosis is life-saving. It is so important for health and well-being, and we know that even economically, if you want to go down that line, it is good economically to pick people up early. It actually saves money in the long time. And so there just is no grounds for the idea that autism is increasing or being overdiagnosed. Because if we look at the research, it shows that there's no increase in autism in children, but what is happening is we are recognising adults, older adults, people without learning disabilities, and particularly women and people assigned female at birth. So we're recognising it more, and that's such a great thing.
I'm wondering what the place of, we talked about overdiagnosis, but I wonder what place diagnosis has in a person's journey. Can it be, it must be a significant life event for a young person, or for any person really.
It is, and I wonder if I'll speak from sort of research and lived experience here. So very often, someone growing up undiagnosed can feel broken. They can feel confused. They can feel worthless because they don't understand, why am I different? Why can't I do all the same things? And very often they might pick up labels or be given labels by other people and really take them on board. So being broken, being stupid, being naughty, being weird, you take all these things into your identity. So when a person gets an autism diagnosis, in a large way, it feels like relief and it feels like vindication. I wasn't a bad child. Also for the parent, my mother wasn't a bad parent. However, I think what I also always want to emphasise is that along with that relief comes grief and anger and all this needless suffering that you needn't have had to go through. And one of the really, I think, huge problems in this country is that post-diagnostic support is virtually, it doesn't happen. And in our survey, we actually had people say that they attempted suicide after receiving an autism diagnosis and experiencing this turmoil of thinking, well, all those people who bullied me, they were right. you can't just shed all those awful things that happened to you and all the awful identities you picked up without that kind of
So it's a kind of a
post-diagnostic.
culmination of all that pain so far.
And you can.
And it has to be put somewhere. And
yeah.
Sometimes people think about suicide
because you don't get any help at all to unpack all that grief and pain. So post-diagnostic support really emerges as a community priority in the work we've been doing, Autism Action and myself in Cambridge.
You mentioned collaboration earlier, Tom, and it's something everybody aspires to, but it's fair to say that since I met you a couple of years ago, sadly at an inquest actually, into the death of a young person whose story was quite complex, but sadly not atypical in the sense of the struggles that had come before the suicide. But since then I've been quietly excited about working with Autism Action and PAPYRUS collectively. We've built a bit of momentum around it. I'm wondering whether we could explore what good looks like for our respective organisations, what we could look like rather than them. And Rachel, chip in please to this, because I think your experience and expertise is invaluable today for this. So I'm going to start by the sort of perfunctory stuff, like saying we're going to look at co-training at each other's teams and make sure that we're as autism aware and you're as suicide aware as each other can learn from the other. Go next. Help me out. What does good look like?
Well, I'm going to embarrass you a bit, really, Jed, because I think what good looks like is something that has really mattered to me as an autism charity, and a sort of small and a young charity looking to do good in the world, has been your openness and your willingness to think, look, we're here. PAPYRUS is an important, life-saving charity for many people, but we want to do more. We were open. Let's have the conversation. Let's explore it. Yeah. And I think it is that I've genuinely found that really inspiring, and your willingness to sit down, to listen to real stories, to listen to the research, to think about what could be done differently, always be building on what you've got. I think it's incredible. So I'm really grateful for that. That's what good looks like to me. Good looks like challenging practice, thinking about the needs of autistic people and how they might differ, not being defensive about, well, we do it this way, we've got our model, it has to stay as it is. You know, being open to thinking about the fact that perhaps there's a group of people here that not everything's going right for, that it could be better for. But you know, what does good look like? It's everything that we've been talking about. There's a long way to go, but I think really starting from a position of empathy and listening, that's the principle we want more people to understand.
Do you want to add anything to that, Rachel? What are you?
I would second what you said. I think good practice in terms of autistic people needs to be person-centred, where I think historically, unfortunately, services have often, if a person doesn't fit their model or their pathway, then it's the person who has to get out. Rather than, okay, let's do something a little bit different. Let's think about what you need. And I think that sort of person-centered, flexible, tailored approach is just so vital to everything when it comes to autistic people.
Even as you say that, I'm thinking of things that we've done well, but things that are still resistant. So, for example, we do a peer education program. We're just in the early days of providing that, and it presupposes that people can deal with metaphor. That's a challenge that we need to learn together about.
One of the things we were talking about earlier was perhaps how helpful it might be. It's such a small thing that if an autistic person's going to phone Hopeline 247, and we know thousands do every year in contact with you, and but that how helpful it might be if the first 3 questions that they're going to be asked were on the website, and they could have a look at that beforehand and feel prepared,
Yeah,
and that
great.
not
We'll
feel
take-
like there's a barrier there. Something really small
We'll
and
take that
practical.
away. Yeah.
And the other thing is, we know, and it comes out in Rachel's research, that sometimes the idea of phone first can be intimidating,
Yeah.
off-putting, can feel like a barrier. I know that Hopeline it's not just a phone line, it's
Text,
it's
email,
web
But
chat.
even in those, there might be learnings like that. What happens when I send a text, and so on.
Yeah, exactly. So there's so much for us to explore.
Yeah,
I'm so excited by the partnership, and I think together we can do great things to fill this gap. There is currently no autism-specific crisis support service in the UK, and we're determined to change that. Work with you, find a model that actually we can take elsewhere, work with other partners, collaborate. I hope we find others as open and as willing to think about things as Papyrus is. But and ultimately there's some lessons for the NHS in that as well.
Yeah. Right, I'm going to put you on the spot and ask you your takeaway message, and I'm putting myself on the spot too. If you had one message that's come out, or one reflection, let's do that. What reflection would you give of this conversation? That's what I wanted to ask you.
For me, it's we've got to move to a position of hope. We've got to understand the problem. We've got to understand the challenge. We've got to move to a position as quickly as possible that's about how can we make changes? How can we improve this? There is hope. There are support services out there, as challenging and difficult as some of them are. People must always ask for help. And if you have someone in your life, talk to them, ask the right questions, ask any questions, and try and get them connected to someone like Papyrus who can help them.
Rachel?
Oh, I'm a bit lost for words. I would really emphasise what Tom was saying about action. We really desperately need action, and quite often I think in policy you often have kind of sound bites without any time or money behind them. And so I think we're at that point where we really know there is a huge problem here when it comes to autism and suicide, and we're actually being offered lots of solutions already from autistic people from research, and those need to be heard and taken forward. In terms of a message for people who might be in this situation, I again find myself lost for words because it is an indescribable experience. Just that we see you, we know how awful this experience is, and we want desperately to change it.
Beautiful, thank you. My message to you, if you've watched this, is 2 words from here: you matter. If you're a parent worried about a child, if you're a partner, if you're an older person, a younger person, doesn't matter what your story is, you matter. You matter to us 3, and you matter to everyone in our organisations. And I really mean that. So if you watch this and you take nothing away, whatever your wall of death looks like, we can help you. So reach out. I promise you, we're here for life. Listen, thank you for watching and listening to this today. It's really important. It's a life-saving conversation. Hopefully somebody watching out there will contact us. There'll be a series of these, so look forward to them, as I will be. We'll be looking at contributory factors to suicide, overlaps with other subject areas like relationships, gambling, alcohol, and much more. So I'm as excited as I hope you will be to look forward to the next episode of our podcast. Meantime, if you need support, or if you know somebody who might, just call us. I don't care what you call us, just call us.